And to break that all down, joining me now from Gaziantep is Yakzan Shishakly, who is the CEO of the Maram Foundation for Relief and Development. Mahmoud Daher, who is the WHO lead of the Gaziantep field presence. And joining me from Belfast is Michiel Hofman, who is a senior humanitarian specialist at Doctors Without Borders. Gentlemen, welcome to Straight Talk. It's good to have you on the program. Yakzan, I want to begin with you. Tell us about the latest situation in Idlib and how are people dealing with the new circumstances?
Well, lucky enough, so far there's no confirmed cases in Idlib, and this is very good news for now, but doesn't mean the people are not living on fear of this COVID-19 virus to break into Idlib. So everybody's trying to take the measures as possible as they can, which is, as you see in the picture now, the camps, to do distance from each other, the social distancing is not doable because of the crowded camp. We're talking about 500 people per 20 tents. So we're talking about a huge number, 5% over the capacity or 50% of the capacity for each tent. We're talking about 5 families living in the same tent. So when we ask them to take the measure for social distancing,
it's not possible. So what is needed urgently? If I'm not mistaken, in all northern Syria, there are just about 200 ICU beds, like all ventilators are occupied, and there are no beds available to accommodate even one case. What can we understand from that? Why all ventilators are occupied now?
I mean, to start with, let's remember, it's a war zone. So we're talking about where the Russian or the Syrian government were destroyed most of the hospitals exist in the area. So we already under and behind the capacity, the normal capacity. And now talking of the ventilators, it's not easy, even if we have the funding from WHO and other partners to buy those ventilators, will not be easy to buy them and get them inside Syria because of what's happening, the panic happening all over.
Yes, we know that. I mean, also we know that 350 health facilities have been bombed and more than 900 doctors, unfortunately, have been killed by the Russian-led regime forces. So, Mahmoud, as the world rings the alarm bells for a potential humanitarian disaster of Idlib if the virus hit the region, the World Health Organization has lately started sending medical aid to northwest Syria. Could you give us some details about your operations in the region?
Yeah, thanks for your question. I think we have been working at the moment on top of an existing emergency situation in the northwest of Syria. As my friend Yakzan has mentioned, there have been lots of fragility in the area and overcrowdedness. So WHO has been working with our partners in order to support the whole situation, the health provision, the healthcare provision in the area, and to be prepared. In fact, at the moment we don't have a positive case, but the fragility and the risk to have a case can be dramatic in the area. And with the high density of the population, we can see dramatic situation. So we are working with our donors in order to allocate more than $34 million that are required for the preparedness and response plan.
Yes,
that has been set together with our partners.
Yeah, your organization is consulting with Idlib authorities to draw up a $30 million plan to create 28 isolation units and prepare new facilities. But Michiel, let me get to you. You have worked in the different parts of the world, and I believe you've seen enough. Yakzan just mentioned it, but even developed countries were unable to prevent a full-blown outbreak. How do we expect people to self-isolate in a densely populated refugee camps? How do they wash their hands regularly if there is no water? And how do they access health care if there's a danger or fear of being arrested? I mean, how vulnerable those people are?
Well, indeed, one of the key concerns is the overcrowding in the displaced camps. And of course, as was mentioned, social distancing in these circumstances or self-isolating, as is used in many other countries, is simply not an option. So first and foremost, We have dramatically increased our support to these displaced camps just by providing hygiene kits, soap, but also to double the amount of water that we have been supplying to this displaced camps. That we are working, serving some 100,000 people, so that they can start with the basics, the ability just to wash their hands. They need to have the water and the soap. But at the same time, we have to work on the assumption that even though there hasn't been no confirmed cases, that the virus is there in the region.
Yes.
So to prepare the healthcare facilities that they're able to actually isolate patients and hopefully at some point also provide treatment is also a main priority for us. That includes making sure that the staff in the healthcare facilities has the protection equipment they need for dealing with suspected COVID-19 cases.
Yes, sure. So, Mahmoud, we're talking about Syria in particular. Do you believe that besides medical aid, an intersectoral intervention is needed, both for Idlib and for Syria? Because we also know that, I mean, crisis times sometimes present opportunities. Do you believe that this pandemic could, in a way, provide an opportunity of peace building in Syria?
Well, this is a very important element. I mean, we have within WHO, we have been raising this issue in many other countries in the world, peace through health. And we have seen how much everybody, not only we, everybody can work together in order to protect the lives of people. I mean, this is the opportunity, in fact, to promote cooperation and collaboration among all conflicting partners in order to settle up a situation here. And the COVID-19 is the invisible enemy that is imposing on the whole humanity. So we need to be all united in order to fight this invisible enemy. And without collaboration, without working together, that cannot be done. This requires, as the Director General said all the time, whole of society, whole of government approach.
And also from a broader perspective, Michiel, I want to continue with you. There are 70 million people worldwide, I mean, who have been driven from their homes by war or unrest or for economic reasons, and 10 million are currently living in refugee camps. So how alarming is the situation and what should be done, in your opinion?
Yes, indeed, and Bangladesh is one of those examples with millions of refugees packed tightly together in a refugee camp, similar to what we see with the displaced in Idlib, where the public health measures as are taken in many countries, like the isolation or the social distancing, is obviously not a strategy that can be used. So it's more important than ever in those places to obviously provide what can be done, the hand washing and the hygiene measures, but also to have a very good availability of testing, so that aggressive tracing and testing can be done in those circumstances, to try to contain the spread of the virus through those means rather than through the means of lockdowns and distancing. Whether or not that is possible with the global shortage for everything in terms of protective equipment, of reagents for testing and all of that is another matter. But those are the preparations that we are making in these refugee camps like Bangladesh, or in the displaced situations like in Idlib.
Mahmoud, do you think Western countries, which by then may have contained their own outbreaks, would respond to the refugees? Will they look the other way again?
Yes, indeed. I mean, we are working with all the donors, and although they have their problems at home, but we are working with many of the donors to continue to respond to the situation in northwest Syria. We have already been receiving calls by donor countries, and that they are very much interested to continue.
But one of your biggest contributors, the United States, has just decided to defund your organization. How will this affect your operations?
Well, that's true. I mean, the Director General has said it. We are hopefully looking for the United States of America to look again at the decision that they made. In fact, the United States of America is one of the biggest donors to the WHO and has been for a long time. I mean, supporting WHO activities and saving lives. But our COVID-19 are continued at the moment. We have, I mean, the United States of America funding is going to other programs, to immunization, to polio eradication, to many other programs that need to be continued as well. However, our COVID-19 response at the moment is going, and we are working with our donors in order to continue that support.
Okay.
Especially in a situation like in Idlib, it's very, very important to keep. This is from the health security point of view as well.
Yeah, but it's not only a problem of Idlib or Syria. Michiel, MSF has ended a cooperation saving migrants at sea with its partner SOS Mediterranean because it suspended the missions due to the coronavirus. And Southeast Asian countries like Malaysia, Bangladesh and Thailand are reportedly preventing especially Rohingya refugees fleeing Myanmar from entering their waters. What do you think? Are these states instrumentalizing outbreak control measures to justify the international violation of law and human principles at sea?
I can't say if these nations are doing this for secondary motives, but it's obvious that measures such as closure of borders that have been imposed by many nations in order to contain the spread of the virus has an immediate effect for those that try to flee conflict and other situations. So we have been always very clear that closing the borders cannot mean that obligations under the refugee conventions are suddenly suspended. So those people that try to flee still have to need to have the ability to do so. The suspension of the search and rescue in the Mediterranean was mostly because the Italian authorities did not allow refugees to be embarking anymore at Italian ports. So that is one example indeed where the normal flow of refugees has been interrupted because of these border closures through COVID-19 measures.
All right, and last question, Yakzan, to you. Are you hopeful about Syria's future, and are there any expectations from Turkey during this crisis times?
Well, we always looking at the future as something going to be brightful, and this is what we're very hopeful for. And Turkey, thankfully, the government of Turkey and the people of Turkey being very supportive to the Syrian people, whether as a refugee or even with the coordination, the partnership to work and response to COVID-19. I just want to highlight this last point, a very important. COVID-19 in general bringing also economic crisis to the area where we're going to face more needs for food and other strategic essential equipment and other support.
All right, gentlemen, I'm afraid we have to leave it here. Thank you very much for joining me on Straight Talk. I appreciate it a lot.
Thank you. Thank you.
Thank you so much.